spend 2 words about urbutresciran and the mechanism of action of this drug?
Yes, certainly. So vutrisiran is a gene silencer that was recently approved for patients with transthyretin amyloidosis with cardiomyopathy. And this was assessed as part of the HELIOS-B trial comparing vutrisiran versus placebo injections every 3 months or so, with a primary endpoint of all-cause mortality and recurrent cardiovascular events. So today I spoke specifically about the effect of age on the efficacy of vutrisiran compared to placebo. And the reason for that is we know historically that the elderly population, one is has more advanced disease at baseline, and secondly, there's a lower use of conventional guideline-directed medical therapies. As part of the study, we demonstrate both categorically and using age as a continuous variable, that there's no modification by age, and that age alone should not be a criterion not to use a promising therapy such as this.
So what are the practical implications of this result for clinicians treating patients of different age?
Yeah, and in terms of the practical implications, what it means is if you do see a patient that's 85, 86, who you may not have considered beforehand, and demonstrate that the evidence shows that they do just as well as someone younger. There is no limitation in the effect. Now, that's not to say that every 86, 87-year-old should be put on it, and it still needs individual patient assessment in terms of their comorbidities and functional status. But what we're trying to say is that age alone should not be something that stops them from getting therapy.